As we age, changes in blood flow and cardiovascular efficiency can affect many aspects of health, including mobility, heart function, and even intimate wellness. While medication and exercise are often emphasized, nutrition remains a foundational and often overlooked factor. In particular, several fruits have been shown in studies to support healthy circulation and blood vessel function, which are essential for both general vitality and intimate health. In this video, we'll review 5 fruits with scientifically supported benefits for improving blood flow and supporting vascular health in adults over 60. Pomegranate Punica granatum is widely recognized for its rich content of antioxidants, particularly polyphenols such as punicalagins and anthocyanins. These compounds have been studied for their role in supporting vascular health by enhancing nitric oxide production and protecting the endothelium, the thin membrane lining the inside of blood vessels. A clinical study published in the journal Clinical Nutrition 2014 investigated the effects of pomegranate juice on patients with carotid artery stenosis, a condition involving the narrowing of the carotid arteries. Over the course of 1 year, participants who consumed pomegranate juice daily exhibited a 35% reduction in carotid intima media thickness, a marker of arterial plaque, while the control group showed a 9% increase. Additionally, systolic blood pressure decreased by 12%, which may be attributed to improved endothelial function and nitric oxide availability. Nitric oxide plays a critical role in vasodilation, the widening of blood vessels which helps improve circulation throughout the body, including to peripheral tissues and reproductive organs. For individuals over 60, where arterial stiffness and reduced elasticity are common, pomegranate's potential to enhance blood vessel responsiveness may offer valuable circulatory benefits. Further support comes from a 2006 study in the International Journal of Impotence Research, where men with mild to moderate erectile dysfunction showed improvement in symptoms after regular pomegranate juice intake. Although more extensive research is needed, these findings suggest a promising link between pomegranate and improved intimate function via enhanced blood flow. Pomegranate is also a source of vitamin C and potassium, both of which contribute to cardiovascular maintenance. Vitamin C aids in collagen production for arterial wall integrity, while potassium assists in balancing blood pressure by modulating sodium levels in the body. Together, these nutrients help support overall vascular resilience. In practical terms, pomegranate can be incorporated into the diet through fresh arils, unsweetened juice, or as part of salads and smoothies. For individuals managing blood sugar, it's important to monitor portion sizes due to the fruit's natural sugar content, though its glycemic load remains moderate when consumed in reasonable amounts. In summary, pomegranate offers multiple circulatory advantages through its antioxidant profile and vascular effects. For older adults seeking to maintain healthy blood flow and support vascular-dependent aspects of health, including intimacy and energy, pomegranate represents a simple yet evidence-based addition to the diet. Bananas Musa sp. are among the most widely consumed fruits globally and are particularly notable for their high potassium content, a mineral essential for cardiovascular regulation. In aging adults, maintaining optimal blood pressure and arterial flexibility becomes increasingly important due to the natural decline in vascular elasticity and an elevated risk of hypertension-related complications. According to the American Heart Association, AHA, potassium helps reduce the effects of sodium in the diet by promoting sodium excretion through urine, thereby lowering blood pressure. A diet rich in potassium has been consistently linked to a reduced risk of stroke and coronary artery disease. Bananas provide approximately 350 c. 400 mg of potassium per 100 grams, making them a convenient and accessible dietary source. A large cohort study published in the journal Hypertension 2017 analyzed data from over 90,000 postmenopausal women. It found that higher dietary potassium intake was associated with a significantly lower risk of ischemic stroke and all-cause mortality. This protective effect was most notable among women with normal blood pressure, suggesting a long-term benefit of consistent potassium intake even before clinical hypertension is diagnosed. In addition to potassium, bananas also supply magnesium and small amounts of vitamin B6, which collectively support nerve function, energy metabolism, and vascular tone. Magnesium, in particular, aids in the relaxation of smooth muscle in the vessel walls, helping maintain optimal blood flow and reduce vascular resistance key factors for circulation and tissue oxygenation in older adults. From a circulatory standpoint, well-regulated blood pressure contributes to improved perfusion of vital organs, including the brain, heart, and pelvic region. This is relevant not only for maintaining cognitive and cardiac health, but also for supporting intimate wellness, as healthy circulation is a prerequisite for adequate blood flow to the reproductive system. Although bananas are relatively high in carbohydrates, they have a moderate glycemic index (GI), especially when slightly underripe. For older adults managing blood glucose levels, pairing bananas with a source of protein or healthy fat, such as yogurt, nuts, or oats can help blunt the glycemic response. In practical dietary terms, bananas are versatile and easy to digest, making them suitable for breakfast, snacks, or pre-activity nutrition. For older individuals with reduced appetite or chewing difficulties, ripe bananas offer a soft, nutrient-dense option that supports both cardiovascular function and energy levels. In conclusion, regular consumption of bananas may assist older adults in managing blood pressure, supporting vascular flexibility, and enhancing overall circulatory efficiency. By contributing to the regulation of electrolyte balance and smooth muscle tone in the arterial system, bananas play a direct and evidence-based role in maintaining cardiovascular and systemic blood flow factors that are vital not only for longevity, but also for sustaining quality of life in later years. Watermelon Citrullus lanatus is a hydrating fruit that contains a unique amino acid called L-citrulline, which has been studied for its role in enhancing nitric oxide production, a molecule crucial for vasodilation and blood flow regulation. In older adults, where endothelial function may decline due to age-related oxidative stress and arterial stiffness, L-citrulline from dietary sources like watermelon presents a potential nutritional approach to supporting healthy circulation. A study published in the journal Hypertension 2010 evaluated the effects of L-citrulline supplementation in adults with prehypertension. Over 6 weeks, participants receiving L-citrulline experienced significant improvements in brachial artery flow-mediated dilation, a marker of endothelial health. While the study used supplemental forms, watermelon has been shown to deliver similar benefits when consumed in adequate quantities due to its high L-citrulline content, particularly in the white rind and inner flesh. Building on this, a randomized controlled trial published in the American Journal of Hypertension 2012 assessed the impact of watermelon extract on blood pressure in older adults with elevated readings. Participants who consumed 6 grams of watermelon extract daily for 6 weeks demonstrated reduced aortic blood pressure and improved arterial function, suggesting that watermelon may contribute to lowering cardiovascular risk factors in aging populations. Beyond L-citrulline, watermelon is rich in lycopene, a powerful antioxidant that helps reduce oxidative damage to blood vessels. Lycopene has been associated with improved arterial stiffness and reduced inflammatory markers, according to a meta-analysis published in Atherosclerosis 2011, which included data from over 1,000 subjects. Improved oxidative balance can directly enhance vascular health, which is fundamental for maintaining steady blood flow to all body systems. Watermelon's high water content, over 90%, also supports hydration status, which is essential for optimal blood volume and circulation. In older adults, who may have a reduced sense of thirst and be at higher risk for dehydration, water-rich fruits like watermelon offer a dual benefit: hydration and cardiovascular support. In the context of intimate health, improved nitric oxide levels and vasodilation are linked to enhanced blood flow to reproductive tissues, which can help address age-related changes in sensitivity, arousal, and function. While watermelon is not a pharmaceutical treatment, its role in supporting vascular response may complement a broader approach to preserving sexual wellness in older adults. From a dietary standpoint, watermelon is low in calories and fat, making it suitable for weight-conscious individuals. Although it contains natural sugars, its glycemic load is relatively low due to its high water content, which dilutes sugar concentration per serving. In summary, watermelon offers several vascular benefits due to its content of L-citrulline, lycopene, and water. For adults over 60, incorporating watermelon into the diet, whether as fresh slices, blended juice, or mixed into salads, may support blood vessel function, help regulate blood pressure, and promote overall circulatory health in a safe and natural way. Strawberries, Fragaria ex ananassa, are nutrient-dense fruits that offer significant cardiovascular and circulatory benefits, largely due to their high concentration of polyphenols, particularly anthocyanins, ellagic acid, and vitamin C. These compounds contribute to the protection and maintenance of blood vessels, especially important in aging populations where vascular elasticity and endothelial function tend to decline. A prospective cohort study published in Circulation 2013 involving over 93,000 women aged 25 to 42 observed that higher intake of anthocyanin-rich foods like strawberries was associated with a 32% reduced risk of myocardial infarction. While the population in this study was younger, the underlying mechanisms, improved endothelial function and reduced blood pressure, are relevant and transferable to older adults seeking to preserve vascular health. The anthocyanins in strawberries act by neutralizing reactive oxygen species, ROS, which can damage the endothelium and lead to arterial stiffening, a common age-related change that contributes to hypertension and reduced perfusion to peripheral tissues. By lowering oxidative stress, strawberries help support the structural integrity of blood vessel linings and promote smoother blood flow. Furthermore, strawberries are one of the best natural sources of vitamin C, with approximately 58 mg per 100 grams. Vitamin C supports the synthesis of collagen, a critical protein for maintaining the elasticity and strength of blood vessels. A meta-analysis published in the American Journal of Clinical Nutrition, 2007, found that vitamin C supplementation was associated with modest but significant reductions in both systolic and diastolic blood pressure, particularly in individuals with elevated baseline readings. In addition to their antioxidant capacity, strawberries may influence nitric oxide availability, a key factor in vasodilation. A controlled trial in the Journal of Nutritional Biochemistry, 2016 demonstrated that strawberry intake improved plasma antioxidant status and endothelial function in adults with metabolic syndrome, which often overlaps with conditions like hypertension, type 2 diabetes, and obesity in older individuals. From a circulation standpoint, enhanced endothelial function and nitric oxide bioavailability can lead to better regulation of vascular tone and improved tissue oxygenation, including in organs involved in reproductive and intimate health. While strawberries are not classified as therapeutic agents, their contribution to vascular wellness indirectly supports several quality-of-life domains in older age. Importantly, strawberries have a low glycemic index (GI), making them suitable for individuals managing blood sugar levels. Their high fiber content further aids in stabilizing postprandial glucose response, which is particularly beneficial in preventing endothelial damage related to glycemic spikes. Dietary incorporation of strawberries is relatively simple and versatile. They can be consumed fresh, blended into smoothies, added to salads, or served with low-fat yogurt. However, individuals taking certain medications, such as anticoagulants, should monitor intake due to the fruit's natural salicylate content, which may interact in rare cases. In conclusion, strawberries support vascular health through multiple mechanisms: antioxidation, anti-inflammation, nitric oxide enhancement, and collagen protection. For individuals over 60 aiming to maintain or improve circulation and blood vessel integrity, regular consumption of strawberries represents a scientifically backed, low-risk dietary strategy. Avocado Persea americana is a fruit distinguished by its high content of monounsaturated fatty acids, MUFA, primarily oleic acid, along with important micronutrients such as vitamin E, folate, and potassium. This nutritional profile offers multiple benefits for cardiovascular health and systemic circulation, key areas of concern for adults over the age of 60. Numerous studies have linked diets rich in monounsaturated fats to improved lipid profiles and vascular health. A randomized controlled trial published in Archives of Medical Research 2005 demonstrated that incorporating avocado into a moderate fat diet reduced total cholesterol, LDL cholesterol, and triglycerides, while increasing HDL cholesterol in both healthy individuals and those with mild hypercholesterolemia. These effects are vital in reducing arterial plaque buildup and maintaining open, flexible blood vessels. Beyond its impact on lipid metabolism, avocado contributes to endothelial function, the ability of the blood vessel's inner lining to regulate vascular tone and blood flow. A study in the Journal of the American Heart Association, 2015, found that replacing saturated fat with avocado-enriched diets significantly improved flow-mediated dilation, a key marker of endothelial responsiveness in overweight and obese individuals. Although not specific to seniors, these findings support the inclusion of avocado in managing age-related vascular changes. Vitamin E, abundant in avocados, is a lipid-soluble antioxidant that helps protect cell membranes from oxidative damage. A review in Free Radical Research 2010 confirmed vitamin E's role in preventing oxidative stress-related endothelial dysfunction, a common contributor to hypertension and atherosclerosis in older adults. Furthermore, vitamin E may support capillary integrity and enhance circulation in peripheral tissues. Avocados also contain moderate levels of potassium, approximately 485 mg per 100 grams, which complements its vascular benefits by helping regulate blood pressure. As noted by the American Journal of Clinical Nutrition 2013, higher potassium intake is associated with a lower risk of stroke and improved arterial compliance. This effect is particularly beneficial in aging individuals who may experience increased arterial stiffness and variable blood pressure. From a broader circulatory perspective, these combined mechanisms, lipid regulation, oxidative protection, and blood pressure support, contribute to maintaining smooth and efficient blood flow throughout the body. This includes perfusion to muscles, organs, and reproductive tissues, all of which can be affected by reduced vascular function over time. In terms of practical application, avocados are highly versatile in meal planning. They can be consumed as spreads, added to salads, or blended into smoothies. Their high caloric density may be a consideration for individuals managing weight. However, their nutrient quality and satiety-promoting properties make them suitable for inclusion in a balanced, portion-controlled diet. Additionally, the high content of plant sterols, particularly beta-sitosterol, may also play a minor role in modulating hormonal balance and supporting metabolic health, though further research is needed to establish direct benefits in the aging population. In summary, avocado provides a combination of heart-healthy fats, antioxidants, and essential nutrients that collectively support vascular health in adults over 60. Its role in reducing inflammation, improving lipid profiles, and enhancing blood vessel function positions it as a valuable dietary component for promoting circulation and preserving quality of life through better cardiovascular and systemic health. Maintaining healthy circulation becomes increasingly important. With age, as it affects not only cardiovascular health, but also overall energy, mobility, and intimate well-being. The 5 fruits discussed in this video, pomegranate, banana, watermelon, strawberry, and avocado, each offer scientifically supported benefits for enhancing blood vessel function, supporting blood pressure regulation, and improving vascular integrity. These fruits contribute nutrients such as potassium, antioxidants, amino acids, and healthy fats that work synergistically to promote smoother blood flow and support the endothelium, the layer of cells that lines the blood vessels. Incorporating them into a balanced diet can be a practical, natural approach to preserving vascular health, especially in individuals over 60. While these fruits are not substitutes for medical treatment, they may complement existing lifestyle and dietary strategies aimed at preventing or managing circulatory issues. For best results, consider combining these dietary choices with regular physical activity, appropriate hydration, and consultation with a healthcare professional, particularly if you have pre-existing conditions or are taking medications. If you found this information helpful, please consider liking the video, subscribing to the channel, and sharing it with others who may benefit. For more science-based guidance on healthy aging and nutrition, be sure to turn on notifications so you don't miss our future content.